My name is Joe Price, and I'm a certified emergency medical technician from Los Angeles County. And from August 11th to August 18th, I was one of the many thousand volunteers who worked at the RAM LA Free Medical Clinic at the Inglewood Forum, providing health care for people who didn't have access to insurance or were underinsured. And I'm here to bear witness that healthcare in America shouldn't be based on the right that you stand in line for 12 hours to get a wristband in order to be able to line up the next day at 4 in the morning. And after you pass the medical screening, you're issued a winning ticket. This is an authentic ticket from the event. And I put it in the sleeve with who's next winning the lotto, because healthcare is a right and shouldn't be determined by the fact that you won the lotto. We need national health care because the people that I saw, I did the medical history of a Vietnam veteran whose teeth were so rotted that I could smell the decay across the table. I helped did medical screen a truck driver who lost his health insurance when he went part-time, and his diabetes is so out of control, if he fails his physical, he'll lose his license to drive truck. And the saddest story I had was an elderly woman who hadn't had eyeglasses in 20 years. And as she got her glasses and was crying, and she told me, now I can go home and read my Bible. These are the real stories of the people that are affected by the lack of health care. That's why we need single payer universal health care now.
There was news reports that they didn't have enough volunteers, that there weren't enough doctors. What was the real situation going on there?
Well, we had plenty of church volunteers that acted as escorts, nurses, EMTs, paramedics, and students that helped in the health screening. But our biggest problem was in doctors with medical degrees, such as ophthalmologists and dentists, because the state of California would not allow out-of-state doctors to come in on a volunteer basis to practice.
And the people that sought this medical help, medical treatment, were they homeless people? Were they what type of people were? Their economic status.
There were a few homeless, but the vast majority were working poor, people that are underemployed, and we even had people who had health insurance but couldn't afford the cost of their copayment.
Did you encounter anyone that was in real critical condition?
We had some people that show up, one man in particular, whose blood pressure was so high, he was 200 over 110, and showing symptoms that he was having a stroke, and we had to have an ambulance rush him to the hospital.
And you had mentioned that you still weren't able to finish some of the people's medical treatments. What happened to them?
Well, one of the sad things is I volunteered to be a healthcare provider, but toward the end of the event, we became a healthcare denier because of the lack of doctors. We had to start limiting the care we could offer, and it was heartbreaking to tell people toward the end that there simply wasn't enough time to get the dental and vision work that they desperately needed.
And you called your experience the good, bad, and the ugly. Can you explain that?
Well, I say the good for what we did by aiding the injured and treating the sick, but the bad was going through this bureaucratic process of having people line up and limited access to health care. And then the ugly part of that there's only so much we could do because it was like draining the ocean with a teaspoon.